just don't know it. We got Dr. Horne? All right, great. Dr. Mark Horne is our guest. Good morning, Dr. Horne. How are you today, sir?
Just fine. Listen, having a little trouble with my earbuds. I don't know. They just wouldn't connect.
That's fine. Got it. Little technical glitches happen sometimes. We appreciate you hanging in there and joining us today. Dr. Horne is, of course, president of the Mississippi State Medical Association. Wanted to get your take on where we stand right now with respect to this Delta variant of the virus, which seems to be circulating and having its way across the country and in our state in particular. I noted the cases are up fairly significantly here of late, and it's a cause for concern.
It is cause for concern. There is a lot of fuel for this fire that's still out there, and there are too many people who are not protected against the Delta variant or any other COVID-19 because they're not vaccinated. There's an overestimation of the number of people who have previously had COVID. Some people say, well, last year I had this cold and it must have been COVID. Well, odds are it wasn't. Sometimes it was, but a lot of times it wasn't. And when they do what we call serological surveillance studies, there's a large chunk of Mississippians who are not covered. We know a big proportion of Mississippians are not vaccinated, and of those people, very few actually have native immunity. And interestingly, the immunity that people get from having had COVID is not nearly as effective at preventing Delta variant as is the immunity that you get from the vaccine. There are some early studies that demonstrate that. So it's a problem. There's a lot of fuel for this fire. We're seeing a lot of younger people, I should say, people in their 40s. I've personally taken care of people in their 40s who were terribly ill from COVID-19. And these are people who were previously very well. So it's a real concern.
Yeah, and so, Dr. Horne, there are a lot of folks that I think just really dismiss the idea that this is even an issue. And I know I've had conversations. I've talked about it here on the program. I've got several friends I play golf with that are physicians, a chief medical officer at a large hospital group, a chief of staff at a large hospital institution. A radiologist is one of my good friends I play golf with that says he's back to spending almost all day reading COVID cases again. And kind of feels like April of last year is what he shared.
It is starting to look a lot like Christmas in summer, so to speak, with COVID Christmas.
Yep.
And it's so unnecessary. I've spent a little time on social media seeing what some of the people are saying that is gaining ground and having people not be concerned. There's so much terrible, terrible misinformation out there. Some of it's just blatant, outright lies. But it's just hard to conceive that people are saying COVID doesn't actually exist, that there's really no virus, that the vaccine is harmful, that the vaccine is deadly, that COVID is all made up. And none of these things are true. And the proof is from those 96% of physicians, practicing physicians in the country who have taken the vaccine, who've had their families take the vaccine, and who are treating these COVID patients and who see it. If there's a grand conspiracy with this, do you really think physicians would be allowing themselves and their family members to die from it? Well, that's what's happened. We have physicians who've died from COVID. We have physician family members who've died from COVID. I protected my family members because I know it's real, and I think everybody else should as well.
Yeah, so if it's okay with you, Doctor, I have sort of written down, just recollecting from memory, the series of the most common objections that I see and hear just out in public or on social media to receiving the vaccination, and would like to get your thoughts on it. First, maybe one of the main one is, why would I get vaccinated against a disease that has such a low mortality rate and for which there are therapies that can cure the disease?
So even though the mortality is low, it is definitely high enough, and we see it happen. It's not low if it's you or someone you care about. That's one.
Yeah.
Number two, the risk of the vaccine is less than the risk of the disease. So the cure or the prevention is definitely better than the disease. Why should we do this if we've got treatments? Well, the treatments we have are good, but they're not nearly as good as people might think. And by that I mean there's no good evidence that it's, again, one of those Facebook and other social media myths that there's really strong evidence for ivermectin being this magic bullet or for hydroxychloroquine being this just amazing treatment that will just stop COVID in its tracks. That's simply not true. That's not been proven in a good, solid scientific way. There are people promoting that fallacy, but it is indeed a fallacy. And the treatments that we do have, things like monoclonal antibodies, yes, we have them, and yes, we really advise people who are at risk who catch COVID to use them. But an ounce of prevention is worth a pound of cure, is the old saying, and vaccine is definitely good prevention.
We got a break right here. Dr. Horne, you can hang with us through the break and talk some more when we come back?
I can.
All right, great. Dr. Mark Horne, president of Mississippi State Medical Association, is our guest. We're talking about COVID and vaccines and objections to the vaccine and his thoughts on that. We'll be right back on the Welcome back, everyone. The JT Show, SuperTalk Mississippi. Dr. Mark Horne, president of the Mississippi State Medical Association, is our guest. I just want to tell our audience that we see the questions coming in on the text line. And I've got every one of those that I've seen come in, I have on my list, and I'm going to get to those with Dr. Horne, so I appreciate that. We were just talking, Dr. Horne, about this low mortality. It seems to be a common objection. But the other thing that's also part of that, isn't it, sir, that you can also have long-term effects, so-called long COVID, as a result of contracting the disease. You might live, and you're not considered statistically a death, but you have a very low and poor quality of life.
I talk to patients every day who've had COVID 6 months, 10 months, 12 months ago, who still have issues with taste, who still have issues with not having the same amount of energy that they had before, short of breath. It can cause long-term consequences. I've seen patients, an interesting one is the cardiomyopathy. People are understandably concerned about the inflammation of the heart that can happen with the vaccine in younger adults, particularly young adult men. The issue is cardiomyopathy from COVID infection happens at a more frequent rate and more severe than with the vaccine. So there's no scenario in which numerically you're safer with COVID than you are with the vaccine. The vaccine is always safer. And I wear my seatbelt everywhere I go. I haven't had a wreck in years. I take my flu vaccine every year, and I take my COVID vaccine to protect me against those things that I cannot control.
Yeah, so I don't know. It's not sort of a binary decision. Well, I'm probably going to live, if I don't take the vaccine, and thus I'm not immunized against COVID. If I get it, I'll be fine. But you might live. But I know I had it, and I had lost the taste and smell for about 3 weeks, and I was deeply concerned that might be permanent, and was advised that was possible. Fortunately, mine ultimately and eventually did return. I have another family member that had it about the same time. That was last November. Still does not have full recovery of taste and smell. I've talked to other folks in the same boat. They've noticed how that's changed. I mean, that's just one of the things. Others have reported so-called brain fog, where they just can't concentrate, can't focus, and then of course just a lethargic sort of way of life as well as an issue, which you touched on. So it's not just about life and death in this situation.
Well, and the life and death thing, one quick point.
Yep.
There's been a 20% increase in all-cause mortality in the state of Mississippi since the beginning of the COVID epidemic. So it is killing a lot of people, a 20% increase in your risk of dying in the state of Mississippi.
Yep. I get it. I just had a listener text in, said I had COVID-19 11 months ago, still no smell. I've heard that as well. So, and then there, of course, with respect to the vaccination, another question that comes up, Dr. Horne, as well. This has not been fully authorized. It's still under emergency use authorization. Therefore, it is kind of an experimental drug. Address that for us.
It is not experimental. It has gone through all of the steps that a normal vaccine would go through, but in a more compressed fashion because of the urgency. The messenger RNA technology that was used for the Pfizer and Moderna vaccines was on the shelf, being developed, and because of the urgency, they were able to finish the development and do the testing in a parallel fashion. The government allowed them to do things in a more rapid way, but still went through all the steps.
Yeah.
And at the same time they were testing, they were building the ability to make it in mass quantities. So what happened is President Trump called it Operation Warp Speed. What he did was he shortened the development time, but not the development steps.
Yeah. Well, I don't know. It seems like, to me at least, when 96% of the physicians are willing, and frankly, while they were waiting, you knew they were committed to getting vaccinated, and frankly, relieved somewhat that they would have this protection, because you could argue they're the most at risk of any in the population, seeing sick people all the time, many of whom have COVID.
I got my first shot in early December, one of the first people in the state to get it, and I couldn't wait to take it. I was chomping at the bits.
Yeah. What about the possibility of long-term effects of the vaccines that folks have concerns about? How would you address that?
So it's interesting, and it gets really deep in the weeds of immunology and vaccine science. The short answer is there's no evidence. Here we are over a year since the beginning of the vaccine trials, and there is no evidence of negative long-term effects. This antibody-associated enhancement that people talk about, yes, it does happen with some vaccines. It has not been shown to happen with this, and it has been carefully developed. There's just no evidence of that, and we should be seeing that by now if indeed it were the case.
Right.
So if we were expecting major adverse consequences, look, there are only about 3 billion plus doses in arms around the world.
Wow.
That's a lot. I mean, billions of doses have been given, and so therefore of various vaccines, and hundreds and hundreds and hundreds of millions of doses of Pfizer and Moderna have been given in the United States and around the world. If we were going to see major problems, we'd see it by now.
Okay, so I guess you're not in a camp that would say, well, we need years more of experience and data to really determine if there's a long-term effect here.
We do not. And if we wait years, then what we do is we lose tens or hundreds of thousands of lives that could have been saved.
Yeah.
I'm not going to, just because the tickets to the concert are expensive, I'm not going to wait until the concert is over to buy my ticket. If I wait, there's a consequence to waiting. There's a risk to taking. There's a consequence to waiting. And those who are arguing that we should wait 2, 3, 4, 5, 10 years to see whether or not there's a consequence are condemning the people who would otherwise be saved by these vaccines to not being saved. So there's a cost on each side, and the cost of taking it is less than the cost or risk of not taking it.
All right. Another common objection I'm sure you've heard is that, well, I see people who are vaccinated are getting COVID.
Yeah, but 95% effectiveness is not 100% effectiveness. And so there is a small number of people, and you can focus on that small number who do get it, or you can focus on the people who didn't get it.
Right.
And the vast majority of people who are getting COVID-19 at this time are not vaccinated. The vast majority of people who are vaccinated are not getting it. So 95% is not 100%.
Why? There's a lot of people that believe that there are a number of people who are getting deathly ill from the vaccine, and the vaccine's actually causing death. What is, I guess, what's the information from the medical community on that?
So the short answer is no, there's not a lot of severe consequences. I've heard people talk about the VAERS data, this vaccine reporting system, and how you need to understand how VAERS works. It's unfiltered reporting of anything you think might be related to you taking the vaccine. So it's good data for trying to figure out where you should investigate. It's not good data for saying the vaccine causes this or causes that. So the VAERS data is being sold or proposed by some as evidence of terrible consequences from the vaccine. It's nothing of the sort. It's an early warning system that says, hey, look over here or look over there. Now, when the scientists from the CDC and WHO and others around the world have looked at that evidence, they have not found significant increases in the severe consequences that people are worried about.
Yeah.
It wouldn't be surprising at all if someone had died from COVID vaccine, but a lot more people have been saved by it.
Yeah, I mean, there have been cases where people have died of Tylenol. I guess we could just split hairs and argue that. I don't know. Doesn't seem like a valid argument to me, honestly.
We need, the innumeracy or lack of understanding of basic numbers has been a problem in understanding this.
Yeah.
People need to look at relative risk. What's the relative risk? Not is there any risk, but what's the relative risk? And
Sure.
The relative risk favors strongly taking the vaccine.
Got it. Hey, you got to go, Dr. Horne. Can you stick around? I got some more questions. I think it's important to get the info out.
I got a minute. I've got a few minutes.
We got a break right here. Dr. Mark Horne, President, Mississippi State Medical Association, is our guest. Stay with us. We'll talk Mississippi, Girard, and Rhino. We've got Dr. Mark Horne, President of the Mississippi State Medical Association. All right, so Dr. Horne, another common objection or just statement, I wouldn't call it an objection, but folks say, well, I've had it and I've had COVID and thus I've got the antibodies and I really don't need the vaccination. And I'll start by just making a comment about my personal situation, which is I did test positive. I went through the quarantine protocol, as I mentioned before. Fortunately, the only symptom I had was total loss of taste and smell. I went back and tested for the antibodies just to see where I was about 3 months later. And when I did so, I didn't show any. I didn't have any. So that seems to just be kind of random, does it not?
Well, that could be a long conversation, but I'll try to make it very brief.
Okay.
When we check for antibodies, that's humoral immunity.
Okay.
There is T-cell or cellular immunity, which can be tested for, but which is much more complicated and expensive. So you probably have some cellular immunity,
All right.
but your humoral immunity has faded. And that's one of the problems I do on occasion test the antibodies to help make a clinical decision for people. And so statistically, likely, and we talk about these things in terms of groups, and you're an individual. So if I were counseling you individually, I'd say, well, maybe, maybe not. And I would tell you that, again, statistically, you would be safer to take the vaccine than not. Odds are you'll do fine, but I wear my seatbelt every day, and I haven't needed it in many, many years.
Sure.
But I still wear it.
It's insurance.
And yeah, it's insurance.
It's just insurance. I mean, I can make that analogy over to my industry, the IT industry, where it's, hey, you may not ever need this. It's just insurance. The security stuff, for example, we try to get folks to invest in. Maybe you won't ever have a ransomware attack, but if you do, it's a pretty good idea. And it's a pretty good decision you made to have something to protect you against that. That's just kind of the same thing here. It's just a form of insurance. It's all a big statistical game, except this game is life and death. Yep.
And I may not need the ransomware protection, but why not?
Yeah, exactly. It's just insurance. A lot of folks buy automobile insurance, homeowners insurance, never make a claim, never have a need for it. But, man, if that ever happens and you can't always control it, it's a pretty dang good thing that you did. All right, so then
when COVID spins out of control, it's bad.
Yep. Yeah, exactly. I think it's a good analogy. Okay, so there are folks that are of childbearing age that are concerned that the vaccination possibly could sterilize them. What would you say to that?
So it's an understandable concern. Certainly, I have I have patients who are of childbearing age, and I understand where they're coming from. And it was a real concern early on, but enough evidence has been gathered that has been put to bed. The American College of Obstetrics and Gynecology has said not an issue. All the other experts who've looked at this have not been able to determine any evidence of that being a problem. And this gets back to some of those things that you see on social media from people from kind of a commentariat. And it makes me think of a sporting, football season. And there's usually some people on social media who are talking about how their coach should have done this, the coach should have done that. They're the perfect, backseat drivers for what the coach should or shouldn't have done to have made the team better. And typically, these are people who may or may not even been able to make their high school team.
Yeah.
I think we need to look to people who are the experts, the immunologists, the physicians who do this on a day-to-day basis, and not to, people who got their Facebook MDs or their TikTok MDs. And yes, not all physicians, not all scientists always agree, but the vast and overwhelming majority of people who do this for a living believe in the vaccine and know that COVID is real. Yeah,
absolutely. Now, how about if a person has had COVID, should they, and they get one of the shots, and in the case of Moderna and Pfizer, where it's a 2-shot regimen, should they get both?
Yes, for protection against Delta, that's one of the newer things that's come out, is one shot of Moderna or Pfizer gives very modest protection against Delta. The 2 shots is what gives the really robust protection against Delta. So the longer we let this virus hang around, if we don't squash it, by not getting vaccinated, by allowing it to hang around, it keeps learning new tricks. It's the campfire that you never fully put out, and it keeps coming back, and it keeps learning new tricks. And so we're worried. I say we. I have some concerns, and I've shared it with others who know more than I do, and they agree that the longer this hangs around, the more likely it is to have another variant which may break through our treatments and/or vaccines. So we need to get it taken care of now while we can.
I want the audience to know what you just said there, Dr. Horne, is precisely what my many physician friends in my circle, and that's half a dozen or so that are all very experienced and high-level physicians, chiefs of staff, chief medical officers, et cetera. That's exactly what every one of them said, that their concern is if we don't arrest this coronavirus variant now, by immunizing, that it has a longer-term opportunity and more availability, I guess, of hosts to keep mutating to a point where the existing vaccinations are not effective. That is what they have expressed, and then we're in serious trouble if that happens.
Well, we would be in another type of trouble. The good news about messenger RNA vaccines is they are quick and easy to adjust and change.
Yeah.
But why wait? Why stretch this out? Let's just get it over with.
Yeah.
We have the tools. All we have to do is use them.
Yeah, so what would you say? We got one of the listeners here says, well, there's lots of folks from the medical community that disagree with your view, and they've been censored and so forth from the various social media. Before you answer that question, I'm just going to say,
sure,
folks, don't make your decision up based on what you see on social media, on anything, honestly, for that matter, especially a medical matter like this. Consult with your physician and have a one-on-one talk. All that I know are more than happy, more than willing, almost any time of day and night, honestly, to have that discussion with you. Don't make that decision based on what politicians and Facebook says.
Yeah, Facebook, I do it at times because I have to.
Yeah.
Not because I want to. I have found that social media is rife. And this isn't just for medical issues. It's rife in politics and in sports and everything else with a bunch of misinformation. You have to be really, really, caveat emptor, buyer beware. pay attention to who you're listening to. I mean, that's just basic common sense that I teach my kids long before COVID, and that I was taught by my parents before anybody knew any of this. So consider the sources and understand that I'm not saying that you always have to go with the majority, but there's a reason the vast and overwhelming majority of physicians and scientists who do immunologists and who do this for a living, there's a reason. You don't have to agree with all their politics. You don't have to think they've always done. You don't have to agree with everything Dr. Fauci has said.
Yeah.
You can say you think he's done some wrong things about the origins and stuff. That doesn't change the facts of COVID is real, it's here, and that the vaccines work. Those things are still true.
Yeah. Well, I don't know. It's just I'm not sure what the magic formula is to encourage folks and to increase our vaccination rate. But I just think that there's a lot of people that seem to be dug in, that they have some and they have questions. And look, the questions are absolutely legitimate, and I believe that is within their right. I don't think it's right for people to say, which to a great extent we're hearing out of the political domain, which is just sit down, shut up, take this vaccine, don't ask any questions. That's not right either. And I hope folks,
I don't agree. I agree with you.
Yeah, and I knew you would, and I also would submit. And we only got a few seconds left here. Just want to get this on the record. Do you support mandatory vaccines from the public, from the government?
I do not believe that the general public should be mandated to take this. In healthcare environments, I'm still formulating it, but I'm sympathetic to the argument that if you're in healthcare and taking care of vulnerable people, it's part of your safety. It's the same as wearing a hard hat at a construction site or fireproof clothing on the oil rig.
Yep.
Having your vaccine is part of your safety gear.
Makes total sense. Appreciate you joining us today, Dr. Horne. Enjoyed the discussion, and thanks for the insight. Take care, sir. We'll talk soon.